Hello and welcome to the weekly Dementia blog. My name is Dr. David Hutchings. I hope everyone had a wonderful Labor Day weekend and some time off with your friends and family. We are continuing our series on what to do after the diagnosis. We're going to talk about that in just a second. I've had a couple questions in regards to what lectures are coming up. This Friday, we have the Behavioral Health Conference in Middle Tennessee, so I'm looking forward to that. And then next Wednesday, I believe it is, we have the National NARA Conference that I'll be speaking at on the impacts of COVID-19 and the pandemic has had on my dementia patients and also the caregivers. And I'll keep you up to date on other upcoming lectures. So let's get started. So what to do after the diagnosis? There is a lot to do. And unfortunately, what happens is that we sometimes get the diagnosis and no information is given to the family and caregivers at all in terms of, um, uh, you know, support groups or the medications or what's going to happen, the dementia staging, the routines, all these things we've been talking about. So I want to continue this series because it's very important not only for the patient and also for the caregiver. So number one is after the diagnosis, making sure that the patient or the loved one understands that he or she has a problem with their memory and cognitive function. This is good to a certain extent. However, if a patient if they get agitated very easily, this is something I probably would not do. And so what I would try to do at that point is maybe try to redirect the patient. And then also seeking out services for elderly attorneys is very, very important. So what we need to do with that is making sure like long-term care insurance and what are the other financial options moving forward. There are different types of dementia, as we talked about, and some forms of dementia actually are much more costlier, especially like your frontal temporal lobe dementias can cost almost twice as much annually than an Alzheimer's. Also, developing time and incorporating time off for yourself as the caregiver is very important, and making sure that we locate the nearest Alzheimer's support groups and meetings to help with that extra support. Pending the stage of the patient, this is something I deal with all the time, nearly on a not a daily basis, but several times a week, is addressing driving safety. So that's something else we have to look at and making sure that we're tested for that. And then making sure that you're addressing family finances and management of the accounts that would need to be moved over to a caregiver or maybe another sibling or a child to help out with that. And also making sure that the patient takes medications correctly. And then also we can put things in the environment like memory aids, clocks, calendars, lists, these types of things to help keep them oriented, but also keep them in control of their environment, which is going to decrease some behaviors. I did a whole blog on routines, so that would definitely say that's a big part of that too, is after the diagnosis, making we establish a daily routine that's going to be similar every single day. And then making sure that we're placing information about contacts and phone contacts and people to contact within for an emergency in a place where they can find it, and it's also very visible and readable. And then also, I'm a huge component of home health care and respite care. So making sure that we have clinical home health come in, such as physical therapy, occupational therapy, those folks that can come in and actually help make some home modifications to keep the patient, as safe as possible in the home environment. Because the last thing we want is to have some kind of rehospitalization that's not necessary. So again, the sitters and respite care are great for the patient and then also for the loved one themselves and the caregivers. We get a lot of questions again on medications, so I'm going to switch gears next week and address some of the medications that we commonly use to treat dementia, Alzheimer's, as well as some of the behaviors that have come from that. So we will see you guys again next week. Thanks again for all the views that we're getting and all the great questions that are coming in, and we'll keep the blogs coming. I appreciate it. Thank you. Have a good week.